My name is Dr. Arthur Desrosiers from Miami, Florida. I'm a board-certified plastic surgeon, and today we're going to talk about hip dips. A hip dip is a normal curve located below the hips where the muscle inserts and there's an indentation. A hip dip is normal anatomy, but it is more pronounced in some people versus others. A hip dip is made out of three anatomic components. The first is here the greater trochanter. So this is the bone that we're talking about, located right below the hip bone up here. The second component is the insertion of the gluteus medius muscle, inserting right here onto the greater trochanter. The third component is the soft tissue. This is the fascia, and the depth of the subcutaneous fat over the fascia varies from person to person. Some people are very happy with their hip dips. Other people ask, can this be filled in? Can it be smoothed? And the answer is yes. My favorite product for injecting hip dips is Leneva. I also use it for high volume injections in the face, the breast, the labia majora, and for liquid BBLs. Leneva is a human allograft adipose matrix. It's sterile, it comes in a syringe, there's no possibility of transmission of diseases. It contains growth factors that stimulate your body to create your own fat. People ask me, how long does the result last when you get a hip dip injected with Leneva? Although the studies have looked out 2 to 3 years and shown long-term retention of fat, in theory, this should be permanent or semi-permanent because the Leneva is stimulating your body to create your own natural tissue. Since this is your fat that is being generated in the areas that we are injecting, it should stay forever unless you lose weight. We inject the amount of Leneva that we need to obtain the ideal correction. Over time, a period of 6 months, gradually your body absorbs the Leneva matrix and replaces it with your own natural fat. When I perform high volume Leneva injections in the office, I use ultrasound for increased patient safety. It increases patient safety because I can visualize the blunt cannula while I'm injecting the Leneva. If you're thinking about getting hip dips done, here are some frequently asked questions. I like Leneva better than other products such as Sculptra or Radiesse because I think it gives more natural results. Leneva is stimulating your body to produce fat from your own cells. There are growth factors in the product that create your own fat for a long-lasting result. People ask, does it hurt? Do you use a needle? The answer is no. I use a blunt-tipped cannula. This decreases the pain and discomfort for the patient during the injection. In terms of post-operative discomfort, when I'm doing the Leneva injection, I mix it with epinephrine and TXA. This decreases the bruising. I also have lidocaine in it, and this decreases the pain and discomfort not only during the injection, but in the immediate period afterwards. Okay, so here's the human allograft. This is the fat matrix, if you will. Open it up. There's 1.5 cc's here. We are going to expand it with 1.5 cc's of lidocaine. So first stage, what I do is I'm going to take some lidocaine. Again, as I said, 1.5, so it's a 1-to-1 ratio, right, of what we're taking out. I'm gonna set this aside, give this to my assistant here. Okay. All right. So this is the allograft. It's a connector, standard female to female connector. So we put each lidocaine allograft together, and then now we gently just mix. You can see slowly mixing it until we get it into a pretty consistent area. And there we go. That's what I call champagne bubbles. Look at that. Beautiful. Okay. Right here, right? And then it goes out basically to here. Okay, so here we are after the injection. You can see the area we filled in, and this hip dip is filled in nicely. So this is post-procedure ultrasound for the hip dip. We are going to evaluate here. You can see here that white curve. That's the greater trochanteric bone. Normal anatomy for point of reference. You have your fascia. Okay, below it's the muscle, above it's the fat. And we move over here to where we did the hip dip, and you can see there's the Leneva, right? That's the fat from the Leneva that's being regenerated. Thanks for watching this video. If you have any questions or there's another topic you'd like me to cover, comment below.